A new FDA-approved anti-wrinkle treatment. It's called Sculptra, and it could become the next big thing in the fight to look younger. Here's NBC's Michelle Kaczynski.
Just a few needles to the face.
Doing okay?
Several $100s a session. And you have the latest breakthrough that doesn't freeze time. It helps you grow some of it back.
These lines here were very, very deep, and that was the only product that helped me considerably.
Sculptra, a filler made from polylactic acid, similar to dissolvable stitches, was first approved here for AIDS patients who lose a lot of facial fat. Now given the A-OK
That's it for this side.
for looks. It makes your body produce more of its own collagen where it's injected, and the results last years, not months.
These lines right there, you know, the ones your makeup sticks in and says, hello, I'm a big wrinkle. That's what doctors say this stuff is good for. And also older, crepey skin and hollow cheeks.
This is a before and after. Dr. Leslie Bauman did the years of clinical trials for the manufacturer at the University of Miami's Cosmetic Research Institute.
I've seen it last 3 years. And the nice thing is at the end of 3 years, they don't need 3 or 4 more treatments. Usually just 1 more treatment will be enough. But you absolutely can make someone's face look 10 years younger.
Husband and wife, Omar and Vivian Fernandez, both took part in the trials and feel that now, even 5 years older,
Oh, it's nice.
they look better.
This part tends to droop a little, and if you can help it, just like if you put on powder to cover something or blush to give yourself a little bit color, I think that's the same thing. So just to make yourself look better.
The downside? Expensive, and you don't see results right away. You get 1 treatment a month at around $800, and after 3, you start to see your old friend collagen coming back.
When we get together with friends, they say, well, what are you doing? You look...
Here's a big caution, though. If you don't go to a doctor who knows what they're doing, you could get big, hard lumps that can only be removed with surgery.
I had a patient who was treated in Atlanta by another doctor who came in and she had huge bumps all under her eyes that you could see, and they felt hard as a rock.
Not pretty. Done right, the newest thing to put back a few of those passing years.
She's a grandmother.
For today, Michelle Kaczynski, NBC News, Miami.
Dr. Roshini Raj is the assistant professor at the NYU School of Medicine and the medical editor of Health Magazine. Dr. Raj, good morning.
Good morning.
Okay, that was some good news and some bad news. We had some like, okay, it's 2 to 4 years, and that's terrific. It's not
Sure.
Botox. But on the other hand, what about these lumps? What are the side effects of this thing?
Well, for general people, it's really very minimal. You get a little tenderness, redness, or swelling around the area of the injection.
For a long time?
Usually it lasts a few days, at the most 2 weeks. Occasionally, in rare cases, you will get these nodules or very painful bumps under the skin.
Keloid?
If you're prone to keloid or scar formation, you should actually stay away from this altogether because you could develop scars. And again, the most important thing is do it with the right person, a board-certified dermatologist or plastic surgeon who has experience in this particular injection.
Yeah, but this is a brand new injection. There are not going to be that many people who are very experienced
well,
at it.
people have to go get special training for it. And, you know, it has been used in Europe since 1999, so we have some data there. It's been used a little bit longer in this country for AIDS patients. So someone who knows what they're doing, who's been properly trained, is definitely a good idea.
So we've gone through the side effects. What are the pluses?
The pluses are many. One is that, you know, it doesn't work right away, which is actually a good thing because you have a more gradual, natural result. It's not like you're going to walk in one day to work and everyone's going to say, whoa, what happened to you? You know, it's a little bit more subtle.
And you can move your eyebrows if you're angry or sad.
Sure,
you don't have to
this
worry
isn't
about the
something,
frozen effect.
Right, it's not something that's freezing your muscles, which is nice. You have some facial expression. And it actually makes your body produce more collagen, which is, and again, that's why it's so long lasting, more than just a few months. The fillers all get resorbed by your body, but this actually has your own body producing more, and that's why it can last up to 2 or even 3 years.
Here's the thing, though. You know, sometimes, and with all due respect to the FDA, because they have a big, big, big job, but we all know that some things have been approved by the FDA and only later are found out to not actually be good for us. There's a real risk, and things have been pulled back. I mean, how long do we need to wait before we can really feel that this is fully vetted?
Well, again, it's been around for a long time in Europe, but of course we trust our own FDA more than European countries. I think you should wait a few years if you're nervous about it, you know, but I have to say a lot of people have been using this even off-label for a while, and it does seem to work, so it's sort of buyer beware. It depends how important it is to you to get those wrinkles. I mean, out of the way.
Well,
you know?
and this is probably a good way time to remind people there are other ways not to have as much aging, and healthy ways that don't require this kind of stuff.
I think prevention is the best thing to do, and first of all, sun damage is number one. So stay out of the sun, especially your eyes. You get a lot of wrinkles around your eyes. Wear the sunglasses. Try to avoid squinting if you can. Exercise, not smoking. These are all things that will help you prevent wrinkles, so you don't have to use one of these things later on.
And I think one of the greatest beautifiers is just simply to try to find happiness.
Absolutely.
I think that's the way.